This meeting is being recorded.
Hello and welcome to the AHEC Scholars Program Orientation. My name is Gloria Burnett. I'm the Alaska AHEC Program Director. And I'm here to give you an overview of the AHEC Scholars Program to provide you with the basics to answer most of your questions that you might have about the ins and outs of the program and ensure that you have all the information you need to be a successful AHEC Scholar. My main goals for today's orientation are for you to understand an overview of the program, why we are taking part in the AHEC Scholars Program, what it's all about, what the requirements are to be a member of the AHEC Scholars Program, some incentives that you will receive for participating in the AHEC Scholars Program, a little bit of logistics to show you how things will work, and then finally an overview of evaluation and follow-up and what that will look like, since that's part of our requirements for our federal funding. So to provide an overview, the AHEC Scholars Program is focused on improving diversity and distribution of healthcare providers throughout the entire country. It's part of a national program through HRSA, the Health Resources and Services Administration, through their Bureau of Health Workforce. The Bureau of Health Workforce funds AHEC's area health education centers throughout the nation. There's one in almost every state, and we have a specific responsibility for helping to increase access to healthcare by encouraging healthcare profession students to practice in rural and underserved areas upon graduation. As a result of trying to not only increase distribution of healthcare professionals, but also improve diversity factors, we do have a priority in our program for underrepresented students. And how we define that is students by their ethnicity, their economic status, whether or not they're educationally disadvantaged. A good example of that is whether or not their parents went to college or if they're a first-generation college student, as well as where they live. If they reside in a rural community, they're considered underrepresented as well. And then what we do is we try to create experiences for those students within rural communities or working in urban centers with underserved populations to better encourage them to select that type of practice upon graduation. So our main goal is we want to see when our students graduate that they're practicing in a rural community or with an underserved population. The AHEC Scholars Program is a 2-year program. There are 2 years worth of requirements. Each year, students have to complete a total of 40 hours of community-based experiential learning, and you'll see throughout the rest of the presentation us refer to that as CBEL hours. And to do that per year. And our year is an academic year. We've defined that by our grant cycle year. So we receive our funds September 1st, and then the funds, we have them through August 31st. So you will have that entire time frame to complete your requirements for each year. So for example, students that start the AHEC Scholars Program in fall 2019 will have from September 1st, 2019 until August 31st, 2020 to finish those first year program requirements. In addition to the 40 hours of community-based experiential learning, students are also required to complete 40 hours of online or in-person coursework. We call that didactic hours, the didactic requirements, and those select didactics are on a series of core topic areas that have been defined for us by our federal funders. I should also note that there are certain programs that are less than 2 years long. We, on a case-by-case basis, we accept students from those programs, and they're in turn only required to be part of the AHEC Scholars Program for 1 year. If your program is one like that, you would know upon your onboarding interview and working with us through the application process whether or not you're eligible and for how long you would be required to be part of the AHEC Scholars Program. If you have any questions about that, you can always ask us, but we usually get that worked out very early in the acceptance process. So you might be asking yourself, what is an underserved population? Some examples of underserved populations in urban centers are any tribal facilities, so any work that's done at South Central Foundation or ANMC or ANTHC can all be considered working with an underserved population. Any work done with homeless populations, volunteering with the Brother Francis shelter, for example, is something that a lot of our students do. That is acceptable. working with domestic violence victims, working with HIV/AIDS populations. We've had quite a few students do some programs through public health nursing that assist with needle exchange programs, for example, things like that would count. Elderly and palliative care, substance abuse and mental health, health profession shortage areas and populations, nurse shortage areas, residents of public housing, anything that would be done within the public housing forum, community experiences or screenings or immunization clinics, things like that could all count. Rural, anything rural, any rural health clinics, any community public health outreach, clinical experiences in rural communities all count as community-based experience for underserved. And then people with disabilities or chronic illnesses are considered underserved populations as well. So we've had students help with camps that were specifically designed for students with disabilities, for example. Those would all be acceptable community-based experiential learning opportunities. One of the questions we get most frequently is, can I double count my CBEL, my community-based experiential learning hours, towards both my requirements for AHEC Scholars and my academic program requirements? And the answer is yes, it is okay to do that. You can double count your community-based experiential learning hours. The problem is we need to make sure that we're working directly with faculty in order to do so. Each faculty member usually works with students, or there's usually a practicum or a clinical coordinator within each department, each health program that helps coordinate clinical experiences. So if we are going to be counting some of those experiences as your AHEC Scholars hours, we need to make sure that they meet our requirements. So they have to be working with an underserved population. So for example, if you're a nursing student and you're doing a clinical rotation at ANMC or at South Central Foundation, those would totally count. They would double count as your clinical hours. However, if you were doing a rotation at Providence, it would not count because that's not considered an underserved population based on the majority of patients they serve, looking at those numbers. So we have to really work together with faculty members to make sure that what they're assigning is indeed an experience that will double count towards AHEC Scholars. On the flip side, if you want to do an experience that we help coordinate for you in a rural community, we really need to work closely with your faculty members to assure that our placement is up to par with all their accreditation requirements for your clinicals. We have done this successfully many times, but my biggest guidance for this is the earlier in the process, the earlier in the year that we could start working on that, the better. Reason being, once your programs start assigning you with a clinical placement, it's really hard to kind of turn back on that. So if we're involved early on, then we can work with our partners at the rural sites to try to make that something that can accommodate both your clinical requirements and your requirements for our Scholars Program. Core topic areas that I mentioned that are part of the didactic training. There are, these are identified, the first few are identified for us by our funders. And then the current and emerging topics were topics that we actually chose for the state of Alaska based on what we saw as high frequency, relevant types of topics that were of great importance to our state. So what we do is we collect kind of a la carte menu of options that you can utilize for your didactic coursework. Cultural competency, that's your topic area, and there'll be a series of different webinars or asynchronous online trainings, or we might have a conference that you can attend locally in your hometown, maybe in Juneau, maybe here in Anchorage, maybe in Fairbanks. All of those topics would be listed on your course site's website, and then that's where you go in and have access to them and are able to track whether or not you completed those hours, and then we score and grade those. So there's a section for each of these areas: practice transformation, cultural competency. Cultural competency, it's pretty self-explanatory. Practice transformation is pretty much all of the things that we're doing on a healthcare policy and processes type of a level to change the standard of care and improve quality. So a lot of quality improvement initiatives telemedicine, telehealth, telepsychiatry, those kinds of things are all gapped. Fee for service versus value-based payments, all of that kind of stuff is clumped under practice transformation. Behavioral health integration with primary care is pretty self-explanatory. Interprofessional education, again, pretty self-explanatory. Social determinants of health, current and emerging topics, and then we have some that we picked, as I said, specifically for Alaska. So chronic disease, geriatrics, substance use disorders, suicide, trauma-informed care, and oral health. Now, with these topic areas, we always send out email blasts to let students know if there's something new that we added that we found out about that would be eligible. Oftentimes this is conferences or live trainings or workshops in each region. So we do have a listserv that we keep, and we send out this information to you all to make sure you're aware of new opportunities as they pop up. On the flip side, if there's something that you know about that we might not know about and you're curious as to whether or not it would count, you could submit those inquiries to Carrie Zielkowski. She's my AHEC Scholars lead here in my office, or to me, and we can work through reviewing those. We usually ask that you send some information about what that training is, whether it's the agenda for the workshop, or it has a blurb, kind of like a conference blurb to get you interested. We need to be able to cross-reference and make sure there's content for the core topic areas that we're required to assure that you have experience with. So once we do that, not only will we allow, if it does, fall into those core topic areas, not only will we allow you, but we'll also get the word out for our other students that this might be an opportunity they'd be interested in. So I always strongly encourage everyone to keep us in the loop on anything that you find that you feel might be a worthwhile didactic to count towards AHEC Scholar requirements. The online or in-person coursework that we're talking about for the didactics, there's a couple different things you can do. I've already mentioned the a la carte menu on course sites where all of our online content is, and our workshops and different events and webinars are listed. In addition to that, we did cross-reference all of the elective courses that are being offered within the university system throughout UAF, UAA, UAS, all the community campuses, and Illisagvik and Alaska Pacific University. That's all of those courses that have electives that could count for didactics are listed in our student handbook. So take a look at those. If you've taken a course within that academic time period, so you're in year one, let's say here starting in fall 2019, if you're planning on taking a course like, let's say, rural health, it's a nursing course, it's an elective, it's already being offered, it's on your schedule for the fall, that course is actually worth a certain amount of hours worth of AHEC Scholars Didactic. We've been able to review these courses as folks take them with faculty members and see how many hours are dedicated to different core topics. So that's another way that you can earn didactic hours. It's not only doing extra, but it could be doing something like an elective that you're already working on. Unfortunately, if it's a core class that you're required to take as part of your program, not an elective where you have a choice in different classes, but a core requirement, core required classes cannot count as didactic. It has to be outside of your core program requirements. So please keep that in mind. And I also had already mentioned that we'll send out emails. So your course site's website is going to be where you upload documentation of completion, whether that be a transcript from the course that you took as an elective that shows that you passed it, or a certificate of completion for a workshop you attended. For some of the online asynchronous trainings, we also do, a little reflection that you write up based on your experiences completing the assignment. So please take your time to take a look at what's interesting to you, noting that you, over the course of the 2 years, if you are an AHEC Scholar for 2 years and not one of those exceptions in the 1-year program, you have a requirement of at least 5 hours per topic area. So you have kind of some flexibility if you're in 2 years that you might not have to do all topic areas in your first year as long as you cover the other ones in your second year. But if you are in a 1-year AHEC Scholar program, you have to make sure you get a minimum of 5 hours per topic area in that year. Another question that we get frequently, what if I've already completed trainings or coursework before I became an AHEC Scholar? So we consider those transfer hours and we do accept them. The only kicker is that the transfer must be completed within the academic year that you're trying to count for the AHEC Scholars Program. So if you took rural health, that nursing course I mentioned earlier, but you took it in fall 2018, unfortunately you couldn't count it towards your requirements because you weren't an actual AHEC scholar until 2019. So it has to be for the same academic year that you are enrolled. There are different types of types of trainings that I've seen students use, and this is another thing to consider. I've had students at Providence that had to take required de-escalation trainings. We count those as part of practice transformation since it's improving the quality of care and helping reduce harm. So if you have done anything like that as part of your work, it's not a core requirement of your program, but you've done it, you've done some training. Maybe you already have mental health first aid, for example, under your belt. As long as you have that proof of documentation that you've done it within that year, we encourage you to submit those via course sites under the transfer credit hours, and then we'll be able to help you through that and approve those hours and count those towards your requirements. On to program incentives. This is something that's changed a little bit from last year. So if you've heard from other students, traditionally we've had a stipend for our AHEC scholars. However, with budget cuts, we had to really look at our budget and see what we can do to ensure that we maximize our resources and make it through this, allowing our students in our AHEC Scholars Program to continue. We realized that prioritizing travel was important because in order to go to a rural community, it costs a lot of money. We wanted to make sure that we had that money for travel expenses. So after thinking long and hard and trying to figure this out, we've come to an agreement that there's going to be either a travel award or a stipend. And how that will look is some students don't go to a rural site. They don't travel. They do their experiences locally. If you're doing your experiences locally, you would be eligible for a $500 stipend. Since you're not leaving, you don't need travel support. We still want to incentivize your participation, so we decided a $500 stipend was the best way to go. For students that do travel, you would receive the same travel awards we always give, which includes your airfare, ferry, or mileage, depending on your mode of transportation, along with 1 week worth of lodging. The 1 week worth of lodging was very intentional. We only have a 40-hour requirement, so we're going to cover lodging for that time period. If you are going to be doing a clinical out in a rural community for longer than 40 hours, which many people do, many students have, a 140-hour requirement. We can't cover all of that lodging, but we hope that supporting you for at least 1 week of that experience will be something that will be enough to help you be able to accommodate those costs. So we also realized that sometimes travel costs do not hit $500. And we wanted to make sure that every one of our AHEC scholars receives at least $500, whether that be via a stipend or via travel support. So if you are a student that is traveling, but your costs only equate to $200 because you're getting mileage reimbursement and you had free housing, in that case, we would provide you with a $300 stipend to make out for the rest. We did have quite a bit of attrition with students not completing, and in order to combat some of the loss of funds that we had because of attrition, we have implemented this year a reimbursement process that you would not receive your reimbursement for travel, and you would not receive your travel your participation stipend, whichever it winds up being, depending on your circumstance. You will not receive any of those funds until you complete all of your program requirements for the year. We had to have some accountability because there was quite a bit of attrition, and we feel that this is the best path moving forward. In addition to the fiscal incentives, you are building employer connections, which is invaluable. You are building resume experience and gaining professional development. And we also support up to $100 of registration fees for your coursework. There are some webinars and conferences and things that we'll share with you that you can do towards AHEC Scholars didactic hours, but they cost money. So to help accommodate some of those costs, we wanted to make sure we offered something to students. So we'll offer up to $100 per year for your AHEC Scholars Didactic, if there are registration fees that you're going to accrue to participate. We will provide housing assistance and placement assistance. We always try to find free housing first. That's our goal. We want to keep housing costs down. So we will work with our partners to do that. Travel support on a reimbursement basis. So we will not be paying for your travel. Instead, what we will be doing is reimbursing you for your travel. You submit all your travel documents and paperwork that we require. And then once you're done with all your program requirements, you will receive a travel reimbursement via your student account. If you are a non-UA student, you would receive that via check. The stipend, similarly, there's going to be one stipend of $500 that you receive upon completion of all requirements, and it too would be deposited into your student account if you're a UA student, and if you're not a UA student, it would be sent to you via check. And then finally, we do have a follow-up and evaluation process. We evaluate you every step of the way. We have a mid-year check-in call where we want to see how things are going and make sure that we're all on the right track for either placement or didactics, whatever it might be. We're here to support you. So we're always, if there's other resources that you need, if you're struggling with a class in particular and you need some tutoring support, we've also been able to reach out to other AHEC scholars and have them support each other in tutoring, especially if they've passed a class the previous semester and have experience with it and someone else is struggling with that. And we've also awarded didactic hours for those types of supports to students that are interested in that. So that's something to keep in mind as well. And then we do a follow-up 1 year after you complete the program, after you graduate. We follow up with you again to see where you're at and hopefully support you with job placement if need be. We help expose you to loan repayment opportunities and resources that are available, and even job listings of postings, especially out in rural communities or with underserved populations that we have on our radar. So we'd be happy to help you with any of that and any of your questions you might have. If you ever have any questions, you can contact me directly, Gloria Burnett. My number is 786-6705, and my email address is gburnett3@alaska.edu. And again, Carrie will be a lead contact that you'll be in touch with. She's working with students as they get accepted and helping them to navigate the process of what we need on file in terms of your registration paperwork. In addition, just wanted to give everyone a heads up that there will be an AHEC Scholars Kickoff event. There will be one every fall, and this year we'll be having it in September. So keep on the lookout for a save the date for that as well. Welcome to the program. I'm really excited to have you. And if you have any questions about any of these facts, this presentation, please do feel free to connect with us directly. Thank you.
This meeting is